The World Small Animal Veterinary Association dental guidelines came about because there is a lack of knowledge in veterinary dentistry. Mostly because we don't get it in vet school. And so because it's not in vet school, we come out and we learn it from the people that didn't get in vet school 20 years ago. So the issue is that the level of care out there is just not where it needs to be. So the guidelines, first and foremost, were created to bridge the gap of lack of knowledge.
I think that when we think about why veterinarians are interested in the guidelines in the first place, an organization like the World Small Animal Veterinary Association, it's an association of associations, and their purpose is to create information that would be interesting to their members, and information they don't feel their members either have access to or would want a better understanding of. So dentistry is probably one of the most important areas for standardization because it is practiced so differently and taught so differently everywhere, if it's taught at all.
And so to develop them, we got veterinary dentists from all over the world. So we have veterinary dentists from 5 continents: North America, South America, Africa, Europe, and Australia. We brought in somebody that also works in the university, so we got that side. So we had different layers of international dentists that could actually go out and tell people how it is in different areas of the country or the world, because again, this is a global guidelines. And on top of that, we all know that we need anesthesia to do dentistry properly. So we brought in an anesthesiologist, we brought in a nutritionist because we talk a lot about the nutritional value and how it can keep teeth clean. And then finally, as we were developing these guidelines, we decided that it was an animal welfare concern. So we brought in an animal welfare advocate to speak to the animal welfare side of and undertreated dental disease.
I think that most veterinarians, when they are first starting practice, when they graduated from school, we don't think about it, but we all swear oaths, right? Whether it's to the AVMA or the Canadian Veterinary Medical Association or the European countries, almost every oath, it contains the concept of advocating for better animal welfare and prevention of suffering in our patients. Dentistry, unfortunately, is one of the least addressed areas by veterinarians for animal welfare concepts, because oftentimes we've been wrongly taught that these conditions don't hurt, that they're okay to just leave, to just watch, which is so sad because we wouldn't watch an animal with a broken leg, and yet we watch an animal who exists every day with a broken tooth. And really, to the animal, pain is pain. So as these guidelines were developed, at each point when we started to talk about the hows of what mattered in a dental situation, I kept directing things back to also the whys of why did it matter? How did it affect our patient's subjective experience that day, that year, that disease process? How did that affect? And I think that the combination of how to do things better and why to do things better, why we should be doing things better, hopefully will really change the way veterinarians look at dentistry internationally.